Hi, I'm Bill Scher.
And I'm Terrence Heath.
Both of us bloggers at ourfuture.org, um, dealing with the fast and furious developments of the healthcare debate. Should progressives be content with the Senate bill as is, without a public option, without Medicare buy-in because we're moving the ball forward on health insurance reform, or um, do we need to draw a line in the sand and say that this is not sufficient reform in any way, shape, or form? Terrence, what say you?
Well, the unsurprising healthcare treachery by Joe Lieberman, I think, underscores uh, a difference or a division, I guess, between progressives and Democrats. And I'm just going to go on the assumption that progressives, by and large, believe that healthcare is a right, having access to affordable quality healthcare. And I compare healthcare reform to every other movement for social change, the civil rights movement, the women's movement, the gay and lesbian movement. And the moderate answer to all of those movements has always been wait. And if you believe that healthcare is a right, that access to healthcare is a right, then it's an injustice that millions of people don't have access to quality, affordable care. And asking them to wait, asking any number of them to wait, is asking them to live with that injustice indefinitely and without remedy for a while. So I think that's the issue that I have with it, and I think other people have too.
Right. I mean, this is the difficulties of governing. You know, what constitutes sitting on your hands and what constitutes moving the ball forward. Um, with understanding that you don't have a form of government that is dictatorial. You know, President
Mm-hmm.
Obama can't dictate the reform that he exactly wants.
Mm-hmm.
Uh, I think people are generally frustrated that Democrats have 60 votes yet can't seem to stop all filibusters because that caucus is a to be charitable, ideologically diverse caucus or a politically corrupted caucus, depending on perspective. Um, but and some people have pushed for, well, you shouldn't be going for a 60 vote bar. You should be going for 50 using Senate budget rules. But there are complications going that route. There are a lot of reforms, like, for example, uh, banning discrimination on pre-existing conditions, which
Mm-hmm.
you could argue that it wouldn't necessarily, but it could get stripped out as not being germane to the budget if you went down the budget rules path.
Right.
So uh, the question becomes, what can you get done with 60 votes? Um, and and this comes down into a question: do you trust that your leaders are fighting as hard as they can to push that boundary? Senator Reid had put a public option in his version, and then you can ask yourself, did Reid fight as hard as he could for that version?
And a lot of people would say no. I mean, especially being an ex-boxer, he's pulled a lot of punches. He hasn't, to me at least, put up the kind of fight that I would like to have seen put up for the public option. And so much time has been spent either placating Republicans or conservative Democrats that essentially we're down to the compromise of the compromise of the compromise of the compromise.
Well, sure.
And that's a very frustrating thing because I don't think that people who progressives, I should say, I'm making a distinction as I will continue to make from now on between progressives and Democrats, didn't sign on for health care for a bit more, but we also didn't sign on for doing nothing.
Whatever we pass now was going to be imperfect. You rarely hit the exact bullseye in one strike. If we had a public option in this, and maybe we still will. I don't want to be the death knell of it.
Right.
Uh, but it's going to be a compromise form. It's not going to be the exact version that we at Campaign for America's Future put on the table in the first place. And it would have to be improved over time as we saw how things work. And we'll have the ability to improve things over time if we forge a deeper bond with the public that active progressive government is a good thing.
And that's what I mean, actually, over that period of time, by increasing our leverage for eight, however many years, the goal has been we need more Democrats in Congress. We need more progressives in Congress. Period.
We do. But the question: how do you get there
And that's
by
that's
holding out more now and not
no,
having
yeah.
legislation, or do you get there by going part of the way and saying, "Hey, I'm working on these things. We're turning the corner. Give me more people to work with."
But my point is not that we hold back or hold off now. But my point is that if we want to get there, um, just getting just getting more Democrats into Congress isn't going to be sufficient. We have to build a progressive majority, and
We
that
do.
is,
And
I think,
one of the difficulties with the current legislative debate is, the only way to get, Nelson, Landrieu, Lincoln, Lieberman to crack is by having a really robust movement on the ground in those states that could make very clear
Right.
it's in your political interest to vote my way and
Right.
not the special interest way.
Right.
And people tried. I'm not.
Oh, I know. People tried with. I mean, there was a huge campaign against Lieberman that came, I believe, pretty close to. At least it was a serious enough threat for him to notice or to make a difference.
In 2006, and
Yeah.
arguably we're suffering the backlash from that.
Right. But
there's efforts on the ground in Nebraska this year and in Arkansas this year to try to pressure them. So it's not a question of effort, but clearly the muscle in certain pockets of the country is not quite yet there,
Right.
where you can really put the hammer down on people, and more work needs to be done to build up that movement.
And that's where I'm kind of focusing right now, because I know we're not going to get an ideal bill, and I know that it's going to be compromised. I've already earlier this week read Democrats saying, well, after we pass the bill, then we're going to do various different kinds of reforms. And if things stay the way that they are now, if the Joe Liebermans of the world are in charge of the Senate and in charge of healthcare, as they appear to be, or as someone appears to be letting them, then we're not going to get there.
Well, and this is what I think we all could do a better job of. It's now a pattern that these right-leaning Democrats and/or moderate Republicans dilute the proposals that are on the table, and yet they never are held accountable for doing that. So the stimulus is not as powerful as it could have been. It was better than doing nothing. We averted a Great Depression. But we're not getting the robust job creation of jobs that we could have had if it was stronger in the first place. Yet it's the president that takes the fall on it, and not Specter, Lieberman, Nelson, Collins, Snow for diluting the bill in the first place. So I would say, pass these things, do the best you can with the Senate you have to work with, but lay down that marker when you do it. This is not what I would have done, and
Right.
when this falls short in this way, it is these guys' fault.
Right.
And we should make amends once it becomes clear that this is not as strong as it could have been.
And frankly, within the Democratic leadership, there needs to be some serious discussions about, okay, are you a part of this, agenda or not? And if you're not, then, Joe Lieberman, if you want to be independent, go be independent.
Sadly, I think he's taken that message.
No, I mean go. Be a real independent. But basically, I think that progressives are going to have to come away with this with an understanding that we have to switch the focus from Democrats to getting more Democrats to getting more progressive Democrats, and moving people in a more progressive direction by increasing the pressure on them at home. I think we need to start showing up for some town hall meetings, and for what it's worth. But I think we're kind of coming at it from coming to the same place from two different points, and it's a reality that I think is just, it's not the greatest, but we are going to have to figure out a way to make healthcare for all a reality, and make sure that this is not the end of the discussion.
We don't want to end the discussion. You've heard what Terrence thinks and what I think. What do you think? Please leave your comments in the thread under this post by clicking the discuss link, and we'll talk to you then.
Thank you.